Hey friends! Welcome to the Adult Nursing CBT quiz. Test your knowledge and keep your skills sharp. Let's see how many questions you can guess. Subscribe and ring the bell to stay updated with our latest videos and resources. Let's dive in. A nurse is caring for a patient with a potassium level of 6.2 millimoles per liter. Which of the following should the nurse prioritize? It's A. Monitor the patient's ECG for abnormalities. Hyperkalemia can cause life-threatening cardiac arrhythmias, so continuous ECG monitoring is essential to detect any abnormalities. A patient presents with abdominal pain, nausea, and vomiting. Which assessment finding would indicate possible dehydration? It's B. Decreased skin turgor. Dehydration leads to decreased skin turgor, often a sign of fluid volume deficit. A patient on warfarin therapy has an INR of 5.2. What action should the nurse take? It's C. Administer vitamin K as prescribed. An INR of 5.2 is above the therapeutic range, increasing the risk of bleeding. Vitamin K can help reverse the effects of warfarin. A patient reports frequent urination, extreme thirst, and unexplained weight loss. Which lab result would confirm diabetes mellitus? It's A. Random blood glucose of 250 milligrams per deciliter. A random blood glucose level of 200 milligrams per deciliter or higher suggests diabetes mellitus. A nurse is preparing to administer 0.4 milligrams of digoxin IV to a patient. The available solution is 0.25 milligrams per milliliter. How many milliliters should the nurse administer? It's D. 0.8 milliliters. Calculation: 0.4 milligrams divided by 0.25 milligrams per milliliter equals 1.6 milliliters. A patient with heart failure is prescribed furosemide. Which electrolyte imbalance should the nurse monitor for? It's A. Hypokalemia. Furosemide is a loop diuretic that can cause potassium loss, potentially leading to hypokalemia. Which of the following symptoms should a nurse monitor for in a patient receiving opioid analgesics? It's A. Respiratory depression. Opioids can depress the central nervous system, leading to slowed respiratory rates and possibly respiratory arrest. A nurse is caring for a patient with a tracheostomy. Which intervention is most appropriate for preventing respiratory complications? It's A. Suction the tracheostomy as needed. Suctioning as needed removes secretions and helps prevent respiratory complications like blockages and infection. A nurse is assessing a patient with liver cirrhosis. Which of the following findings is expected? It's C. Jaundice. Jaundice is a common symptom of liver cirrhosis due to the liver's reduced ability to process bilirubin. A nurse prepares to give an intramuscular IM injection in the deltoid muscle. What is the maximum volume that can be safely administered in this site? It's D. 1 milliliter. The deltoid muscle can safely receive up to 1 milliliter of medication due to its smaller muscle mass. A nurse is reviewing dietary teaching with a patient on a low-sodium diet. Which food should the patient avoid? It's B. Canned soup. Canned soups are typically high in sodium and should be avoided on a low-sodium diet. A patient with pneumonia has a temperature of 39 degrees Celsius. What is the nurse's priority intervention? It's B. Administer an antipyretic. An antipyretic helps to reduce fever, alleviate discomfort, and helping manage the patient's condition. Which finding in a urine sample would indicate a possible urinary tract infection, UTI? It's A. Cloudy appearance. Cloudy urine may indicate the presence of bacteria, white blood cells, or other signs of infection. A nurse is caring for a patient on oxygen therapy. Which of the following interventions is correct? It's D. Remove all sources of open flame. Oxygen is highly flammable, so it's essential to eliminate any sources of ignition. Finding indicates a potential complication of IV therapy. It's A. Redness and warmth at the site. Redness and warmth suggest phlebitis or infection, both complications of IV therapy. A patient is receiving IV potassium chloride for hypokalemia. What is the most important nursing consideration? It's A. Ensure the infusion rate is slow. Potassium must be administered slowly to prevent dangerous cardiac arrhythmias and burning sensations. Which of the following foods should a nurse recommend to a patient with iron deficiency anemia? It's A. Spinach. Spinach is a good source of iron and can help improve iron levels in patients with anemia. A patient reports feeling dizzy when moving from a lying to a standing position. What is the most likely cause? It's C. Orthostatic hypotension. Dizziness upon standing often indicates orthostatic hypotension, where blood pressure drops suddenly. A nurse is preparing to administer 2 milligrams of morphine IV. The vial contains 10 milligrams per milliliter. How many milliliters should the nurse administer? It's D. 0.2 milliliters. Calculation: 2 milligrams divided by 10 milligrams per milliliter equals 0.2 milliliters. A nurse is educating a patient with peptic ulcer disease on lifestyle modifications. Which recommendation is appropriate? It's B. Avoid NSAIDs. NSAIDs can exacerbate peptic ulcer disease by irritating the stomach lining. A patient in the emergency department is experiencing anaphylaxis after being stung by a bee. What is the priority nursing intervention? It's A. Initiate intravenous access and administer epinephrine. Epinephrine is the first-line treatment for anaphylaxis and should be administered promptly to counteract severe allergic reactions. A nurse is caring for a patient diagnosed with chronic kidney disease, CKD. Which dietary modification should be implemented? It's D. Limit sodium and potassium intake. Patients with CKD often require dietary restrictions on sodium and potassium to prevent fluid overload and hyperkalemia. A patient with diabetes mellitus is scheduled for surgery. What is the priority action the nurse should take before the procedure? It's A. Check blood glucose levels. It's essential to monitor blood glucose levels to manage diabetes effectively and prevent complications during surgery. A nurse is assessing a patient's pain level. Which scale is appropriate for a patient who is nonverbal? It's A. Flaxey scale. The Flaxey scale is designed for assessing pain in nonverbal patients based on observed behaviors. A patient is prescribed a beta blocker for hypertension. Which side effect should the nurse monitor for? It's A. Bradycardia. Beta blockers can decrease heart rate, so the nurse should monitor for bradycardia as a common side effect. A nurse is reviewing medication orders. Which medication should be given with caution to a patient with a history of heart failure? It's C. Ibuprofen. NSAIDs like ibuprofen can cause fluid retention and exacerbate heart failure symptoms. A patient presents with a severe headache and hypertension. Which of the following medications is most appropriate to administer? It's D. Hydralazine. Hydralazine is a vasodilator that can effectively lower blood pressure in patients with hypertension and headache. A nurse is caring for a patient recovering from a stroke. Which finding indicates improvement in the patient's condition? It's B. Ability to follow simple commands. Following commands indicates improved cognitive function and neurological recovery. Patient with asthma is experiencing wheezing and shortness of breath. What should the nurse administer first? It's D. Short-acting beta agonist. SABAs, like albuterol, are first-line treatments for acute asthma exacerbations, providing rapid relief of bronchospasm. A nurse is monitoring a patient receiving heparin. Which laboratory test should be checked regularly? It's B. Activated partial thromboplastin time, APTT. APTT is used to monitor the effectiveness of heparin therapy and to prevent complications such as bleeding. A patient is receiving chemotherapy and develops oral mucositis. Which intervention should the nurse implement? It's B. Encourage mouth rinses with salt water. Saltwater rinses can help reduce inflammation and promote oral hygiene, alleviating symptoms of mucositis. A nurse is teaching a patient about a low-cholesterol diet. Which food should the patient avoid? It's A. Butter. Butter is high in saturated fats, which can contribute to increased cholesterol levels. A patient with a history of alcoholism is being treated for pancreatitis. What is the most important nursing intervention? It's D. Encourage fluid intake. Patients with pancreatitis are at risk for dehydration. Adequate fluid intake is crucial for recovery. A patient with chronic obstructive pulmonary disease, COPD, is receiving oxygen therapy. What is the nurse's priority assessment? It's A. Monitor oxygen saturation levels. Ensuring adequate oxygenation is the priority for patients with COPD, and monitoring saturation levels is essential. A patient is diagnosed with deep vein thrombosis, DVT. Which sign or symptom should the nurse expect to find? It's A. Warmth and swelling in the affected leg. DVT typically presents with warmth, swelling, and tenderness in the affected extremity due to inflammation and clot formation. A nurse is assessing a patient with hypertension. Which lifestyle modification should be recommended? It's A. Engage in regular physical activity. Regular exercise helps lower blood pressure and improve overall cardiovascular health. A patient with a history of seizures is being discharged on phenytoin. What instruction should the nurse provide? It's C. Notify the provider of any rash. Phenytoin can cause serious skin reactions. Any rash should be reported immediately. A nurse is administering a blood transfusion. Which action should be performed first? It's D. Ensure the correct blood type and match. Verifying the blood type and compatibility is critical to prevent transfusion reactions. Which intervention should the nurse implement first? It's B. Administer prescribed pain medication. Pain management is a priority. Administering medication will help alleviate discomfort quickly. A patient with chronic kidney disease is prescribed erythropoietin. What should the nurse monitor in this patient? It's A. Hemoglobin and hematocrit levels. Erythropoietin stimulates red blood cell production. Monitoring hemoglobin and hematocrit levels ensures effective treatment. A patient with diabetes is experiencing hypoglycemia. What is the priority nursing intervention? It's D. Give the patient orange juice or glucose tablets. Quickly providing carbohydrates will raise blood glucose levels and treat hypoglycemia effectively. A nurse is assessing a patient with a suspected stroke. Which assessment tool is commonly used to evaluate the patient? It's A. National Institutes of Health Stroke Scale, NIHSS. The NIHSS is specifically designed to assess the severity of a stroke and guide treatment decisions. A patient is admitted with acute pancreatitis. Which laboratory result would the nurse expect to be elevated? It's A. Serum amylase. Serum amylase levels are typically elevated in acute pancreatitis, indicating pancreatic inflammation. A nurse is educating a patient on the use of a metered dose inhaler, MDI. What is the most important instruction to provide? It's A. Shake the inhaler before each use. Shaking the inhaler ensures that the medication is well mixed and delivered effectively. A patient diagnosed with heart failure is prescribed a thiazide diuretic. What should the nurse monitor closely? It's C. Serum electrolytes. Thiazide diuretics can cause electrolyte imbalances, particularly hypokalemia and hyponatremia. A nurse is caring for a patient with a chest tube. Which findings should the nurse report immediately? It's D. Continuous bubbling in the water seal chamber. Continuous bubbling may indicate an air leak in the system, which should be addressed immediately. A patient presents with symptoms of dehydration. Which finding should the nurse expect? It's B. Decreased skin turgor. Decreased skin turgor is a classic sign of dehydration, indicating fluid loss. A nurse is caring for a patient with chronic pain. What is the most effective pain management strategy? It's A. A multimodal approach combining medications and therapies. A multimodal approach addresses pain from different angles, improving overall pain management effectiveness. A patient receiving warfarin therapy has an INR of 2.0. What does this indicate? It's B. The warfarin is at a therapeutic level. An INR of 2.0 is within the therapeutic range for most indications for warfarin therapy. A nurse is assessing a patient with a suspected fracture. What is the priority nursing action? It's C. Check for neurovascular status. Assessing neurovascular status is crucial to determine if there is compromised blood flow or nerve function. A patient recovering from surgery is experiencing nausea. What is the most appropriate initial intervention? It's A. Administer antiemetic medication. Administering antiemetic medication can help alleviate nausea quickly and improve the patient's comfort. A nurse is caring for a patient with chronic obstructive pulmonary disease, COPD, who is using home oxygen therapy. What is the most important teaching point for this patient? It's D. Monitor oxygen saturation levels regularly. Regularly monitoring oxygen saturation ensures the patient is receiving adequate oxygenation. A patient with a history of chronic kidney disease is being assessed. Which symptom might indicate worsening kidney function? It's A. Edema. Edema can indicate fluid retention due to worsening kidney function, which is common in chronic kidney disease. A nurse is teaching a patient about the importance of fiber in the diet. Which of the following statements is correct? It's A. Fiber aids in digestion and prevents constipation. Fiber is essential for maintaining healthy digestion and preventing constipation. A nurse is caring for a patient receiving chemotherapy. Which nursing intervention is appropriate to prevent infection? It's A. Encourage hand hygiene practices. Hand hygiene is crucial in preventing infection, especially in immunocompromised patients receiving chemotherapy. A patient with a history of alcohol use disorder is admitted for detoxification. What is the nurse's priority assessment? It's C. Withdrawal symptoms. Assessing for withdrawal symptoms is critical for timely intervention and management during detoxification. A nurse is preparing to discharge a patient with a new diagnosis of hypertension. Which instruction should be included in the discharge teaching? It's D. Monitor blood pressure at home. Monitoring blood pressure at home helps the patient manage their condition and identify any potential issues. A nurse is assessing a patient with chronic liver disease. Which finding is most indicative of hepatic encephalopathy? It's B. Confusion or altered mental status. Hepatic encephalopathy is characterized by confusion and altered mental status due to the accumulation of toxins in the blood. A patient is receiving a blood transfusion. What is the most important nursing action before starting the transfusion? It's A. Verify the patient's identity and blood type. Accurate identification and blood type verification are critical to prevent transfusion reactions. A nurse is caring for a patient with chronic pain. Which pain management strategy should be prioritized? It's B. Administer medications as prescribed. Administering prescribed pain medications is essential for effective pain management in chronic pain patients. A patient with heart failure is prescribed furosemide. The patient asks how the medication works. What is the best response? It's C. It helps your kidneys remove extra fluid. Furosemide is a diuretic that promotes the excretion of fluid through the kidneys, reducing fluid overload in heart failure. A patient is being discharged after a total hip replacement. Which instruction should the nurse emphasize? It's A. Keep the hip in a neutral position. Maintaining the hip in a neutral position helps prevent dislocation after surgery. A patient with pneumonia is prescribed antibiotics. What is the nurse's priority intervention? It's D. Obtain a culture and sensitivity test. Cultures should be obtained before starting antibiotics to identify the causative organism and ensure appropriate treatment. A nurse is assessing a patient with a possible myocardial infarction. Which symptom would be most characteristic of this condition? It's A. A dull, crushing chest pain that may radiate to the jaw. This symptom is characteristic of myocardial infarction and requires immediate medical attention. A patient with chronic lung disease is experiencing dyspnea. What is the best nursing intervention to alleviate this symptom? It's A. Position the patient in a high Fowler's position. High Fowler's position promotes lung expansion and facilitates easier breathing. A nurse is teaching a patient about the use of a glycoprotein 2B/3A inhibitor after a myocardial infarction. What is the expected action of this medication? It's A. Prevents clot formation. Glycoprotein 2B/3A inhibitors prevent platelet aggregation and reduce the risk of further clot formation after a myocardial infarction. A nurse is preparing to administer a medication through a nasogastric NG tube. Which action should be taken? It's C. Crush all medications into a fine powder. Crushing medications into a fine powder ensures they can pass easily through the NG tube, provided they are safe to crush. A nurse is monitoring a patient receiving potassium chloride. What is the most important assessment? It's C. Serum potassium level. Monitoring serum potassium levels is critical to prevent hyperkalemia, which can lead to life-threatening cardiac complications. A patient is admitted for treatment of a suspected pulmonary embolism. What is the priority nursing intervention? It's B. Provide oxygen therapy. Oxygen therapy is a priority to ensure adequate oxygenation in a patient with pulmonary embolism. A patient is experiencing a panic attack. Which nursing intervention is most appropriate? It's B. Guide the patient through deep breathing exercises. Deep breathing exercises can help alleviate anxiety and provide immediate relief during a panic attack. A nurse is educating a patient about the signs of infection following surgery. Which statement indicates a need for further teaching? It's A. Pus drainage is a normal sign of healing. Pus drainage is not normal and may indicate an infection, requiring further evaluation. A patient is being discharged after a myocardial infarction. What medication should the nurse educate the patient about taking indefinitely? It's D. Aspirin. Aspirin is typically recommended indefinitely after a myocardial infarction to reduce the risk of further cardiovascular events. A patient with a history of hypertension is experiencing chest pain. What should the nurse assess first? It's A. Blood pressure. Assessing blood pressure is critical in managing chest pain, especially in a patient with hypertension, to determine the next steps in treatment. A nurse is caring for a patient who underwent a total knee replacement. Which intervention is important for post-operative care? It's A. Encourage ambulation as soon as possible. Early ambulation promotes circulation, prevents complications, and aids recovery after surgery. A patient is being treated for tuberculosis, TB. Which nursing intervention is essential? It's A. Implement airborne precautions. TB is transmitted via airborne droplets. Implementing precautions is essential to prevent transmission. A nurse is teaching a patient about the use of a spacer with an inhaler. What is the primary benefit of using a spacer? It's C. It allows for better medication delivery to the lungs. A spacer helps to hold the medication in the device, allowing for better inhalation and absorption in the lungs. A patient receiving chemotherapy asks why their hair is falling out. What is the best response? It's D. Chemotherapy affects rapidly dividing cells, including hair follicles. Chemotherapy targets rapidly dividing cells, which includes hair follicles, leading to hair loss. A nurse is caring for a patient with chronic heart failure. What assessment finding would indicate worsening heart failure? It's B. Weight gain of 2 to 3 pounds in a week. Rapid weight gain can indicate fluid retention and worsening heart failure. A patient with a history of allergies is being assessed for anaphylaxis. What is the first sign the nurse should monitor for? It's A. Skin rash or hives. Skin reactions, such as rash or hives, are often the initial signs of anaphylaxis before progressing to more severe symptoms. A nurse is caring for a patient who is receiving mechanical ventilation. What is the priority assessment for this patient? It's D. Monitor oxygen saturation levels. Ensuring adequate oxygenation is critical for a patient on mechanical ventilation. A patient with chronic obstructive pulmonary disease, COPD, is being discharged. Which instruction should the nurse include? It's A. Increase fluid intake to thin secretions. Increased fluid intake helps thin mucus secretions, making it easier for patients with COPD to expectorate. A nurse is caring for a patient experiencing a seizure. What is the priority nursing action? It's A. Protect the patient from injury and ensure a safe environment. Ensuring the patient's safety during a seizure is the priority. Restraining the patient or placing objects in their mouth can lead to injury. A patient recovering from a myocardial infarction Asks about the purpose of a beta blocker. What is the best response? It's A. It reduces the workload on your heart and lowers blood pressure. Beta blockers decrease heart rate and myocardial contractility, thus reducing the workload on the heart. A nurse is providing education about the signs of diabetic ketoacidosis, DKA. Which sign should be included? It's C. Deep rapid breathing, Kussmaul respirations. Kussmaul respirations are a compensatory mechanism for metabolic acidosis, common in DKA. A nurse is assessing a patient with liver cirrhosis. Which finding is most concerning? It's D. Altered mental status. Altered mental status may indicate hepatic encephalopathy, a serious complication of liver cirrhosis requiring immediate intervention. A nurse is teaching a patient about the side effects of a new antihypertensive medication. Which side effect should the nurse emphasize? It's B. Dizziness or lightheadedness. Dizziness or lightheadedness can occur due to orthostatic hypotension, especially after the first dose. A patient presents with chest pain and diaphoresis. What should the nurse do first? It's D. Assess vital signs. Assessing vital signs is essential to determine the patient's stability and guide further interventions. A nurse is caring for a patient with a pressure ulcer. Which intervention is the priority for preventing further skin breakdown? It's B. Turn and reposition the patient every 2 hours. Regular repositioning is crucial to relieve pressure and prevent further skin breakdown in patients with pressure ulcers. A patient receiving chemotherapy complains of mouth sores. What should the nurse recommend to help alleviate this symptom? It's B. Rinse with salt water or baking soda solution. Rinsing with a salt water or baking soda solution can help soothe oral mucositis and promote healing. A nurse is caring for a patient with hypothyroidism. Which medication should the nurse expect to be prescribed? It's A. Levothyroxine. Levothyroxine is a synthetic thyroid hormone used to treat hypothyroidism. A patient with heart failure is prescribed digoxin. Which symptom should the nurse monitor for as a potential adverse effect? It's D. Bradycardia. Digoxin can cause bradycardia. The nurse should monitor the patient's heart rate regularly. A nurse is assessing a patient with an exacerbation of asthma. Which finding is most concerning? It's A. Use of accessory muscles for breathing. The use of accessory muscles indicates respiratory distress and can signify a severe asthma exacerbation. A patient undergoing dialysis has a low hemoglobin level. What is the priority nursing intervention? It's A. Administer iron supplements as prescribed. Patients on dialysis often have low hemoglobin due to inadequate erythropoietin production, and iron supplements can help increase hemoglobin levels. A patient with a history of peptic ulcer disease is prescribed a proton pump inhibitor, PPI. What is the expected action of this medication? It's A. It inhibits gastric acid secretion. PPIS decrease gastric acid production, which helps heal ulcers and reduces symptoms. A patient is prescribed an oral hypoglycemic agent. What is the nurse's priority teaching point? It's C. Take the medication with food. Taking oral hypoglycemic agents with food can help prevent gastrointestinal upset and improve absorption. A nurse is caring for a patient with a new colostomy. What is the priority teaching point for the patient? It's D. Recognize signs of complications such as leakage or skin irritation. Teaching the patient to recognize complications ensures early intervention and proper care of the stoma. A nurse is monitoring a patient receiving IV fluids. Which finding would indicate fluid overload? It's B. Edema, CHA. Edema is a common sign of fluid overload, indicating that the body cannot handle the excess fluid volume. A patient with diabetes mellitus is being educated about foot care. What should the nurse emphasize? It's A. Inspect feet daily for injuries. Regular inspection helps identify injuries or ulcers early, preventing complications like infections or amputations. A nurse is assessing a patient with an acute kidney injury. What laboratory finding is most expected? It's D. Increased blood urea nitrogen, BUN. In acute kidney injury, BUN levels typically rise due to impaired renal function and reduced clearance of waste products. A nurse is caring for a patient with chronic pain who is prescribed opioids. What is the most important nursing intervention? It's A. Monitor for signs of respiratory depression. Opioids can cause respiratory depression, making it essential for the nurse to monitor the patient closely for this potentially life-threatening side effect. Great job completing the medical quiz. Keep up the learning, and remember, each step brings you closer to mastering your skills. Thanks for joining, and see you next time.